concern.
It happens.
Well, it doesn't link that way, that's why I emailed them to you. So in the email that had it. You're good.
I'd like to call this meeting together. It's May 14th. To be a special meeting of the Board of Supervisors.
Is your microphone on?
Thank you. I'd like to call this meeting together. It's May 14th. This is the special meeting of the Board of Supervisors to discuss the COVID issues. The Board of Supervisors may by motion recess into executive session to receive legal advice from the board's attorney on any item contained in this agenda pursuant to ARS 38-431-03. The first item we'll take up would be the discussion of possible action, an update from the County Public Health Director, Board of Supervisors regarding the recent issues, actions, events, and county responses to the COVID-19 updates and taking any necessary actions based on these updates. So Denise Burley, welcome.
Great. Thank you, Madam Chair, members of the board. I just have a few updates, and certainly I'll be available for questions at the end. Looking at our hospital capacity report, you probably just received that. And of note, the one item that may stand out is back to Havasu Regional Medical Center. And in that, they show that they have 0 ICU beds available. I also know that we want to continue to repeat that these hospitals have the ability and functionality to be able to scale up and scale down. So as needed, they will be opening up other beds and make them available for additional ICU patients. That's part of their surge capacity, and they will continue to operate that way as needed. But that's a function of their plans and also ensuring that they have the appropriate number of beds available at any given time to meet the demand.
Okay.
Any questions on capacity?
I see none.
Okay. The personal protective equipment that we'll be talking about, I just wanted to mention that first responders now have the availability of a Battelle system, and Byron may be able to speak more to this than I, but essentially it gives emergency response agencies the ability to reuse N95 masks. That Battelle system will actually sanitize those masks and allow them to be reused. So the organizations can register for that service, and then there are specific directions that they would follow in order to get those masks to the actual Battelle agency or the group that's running the Battelle system, and then those masks then come back to them. So they're labeled, and they had, excuse me, didn't bring my water today. They've got them labeled per person and per agency so that way they can get them back to the right people. But that will help us in the long run until N95 masks become more readily available, and that supply chain opens up more.
Good report.
An update on the cases in Needles and Laughlin. We do monitor some of our neighboring communities. And in going to the dashboards today for those two particular communities, it still indicates for the San Bernardino webpage that there are 0 cases in Needles. We do realize they had a testing event last week, I believe, or actually it might be this week. I may get my dates wrong there, but that may show an increase in the number of cases. Currently, they're not. That community is not even listed. Needles is not listed on their webpage. Additionally, the number of cases in Laughlin is still at less than 5, so that information is suppressed, other than to know that it's less than 5. Any question on cases? Okay. All right, we just want to remind everyone of the case.
Denise, I think Supervisor Angus did have a question.
I'm sorry, yes.
So Laughlin did have a 1,000 test blitz this Tuesday.
Tuesday, thank you.
Right. And so any indication when those test results are going to come back?
Well, I imagine it depends on the lab that will be running them.
Right.
And so it may be that those test results will be, like for ours through Sonora Quest, they were usually running about 24 to 48 hours
Right.
out. So I would anticipate at least the same for them with that number of tests.
And just so you know, I know they were taking reservations from people who lived in Mojave County as well. So we may see some new numbers, or I don't know where they send it to, but you might want to check that out.
We will do that. Thank you.
Okay.
Yeah, and we will get reports of any positive cases within our county. So that will be something that we monitor through the MedSys program. So, all right, the next testing event in our county will be this Saturday in Lake Havasu City at the Aquatic Center, 6 a.m. to 11 a.m. Same process. The pre-registration that they indicate on their website is really to download the form. There's no schedule. It's first come, first serve, and they will serve everybody that they can between 6 a.m. and 11 a.m. So we'll get a good indication of community-acquired cases in those communities with that type of testing. So it's a good screening tool for us. Our contact tracing pilot with the state, I just wanted to update you on that as well. ADHS is still finalizing their plans for using the automated system, so we have not begun that process. We are still working out sort of a plan on our part of how we will utilize that particular program. And that's an automated system where people can choose to enroll in the program. That's not a requirement. We do know some people are not comfortable with technology. Others are not comfortable with technology for security purposes. So they do have the option not to enroll in this program and continue either on with a personal level phone call from one of our staff, or in some cases, they don't have to actually enroll. I mean, it's not a mandate that people sign up for contact tracing follow-up. So those are the 3 options. So we're also training some of our staff to do contact tracing and more to do the monitoring side of that. And we did identify a online training for staff that where their programs are in a downtime. Maybe they would normally be in the schools, maybe their work would be more out in the public, and so that load has been less. And so we are asking those staff to attend that particular online training, and then we will have an in-person or via Skype type training here next week on Wednesday to try to address questions and provide more practical kind of hands-on experience for that. So we should have approximately, I think about 6 staff actually will be participating in that. So that will help us relieve some of the stress that's been on the nurses to do that, to perform that role. And as the case counts have gone up and the contact tracing has become more extensive, this will take some of that burden off them and put it into the hands of other staff. So we'll be delegating those responsibilities out. And I apologize, I want to circle back real quick to the testing numbers. I know there was interest in the 2 testing events that have already occurred, Kingman and Bullhead City. And I did get some testing numbers of where people came from for those testing events. For example, the Kingman testing event had 81% of the people were Kingman residents, and then 9% were Golden Valley residents. And then beyond that, we got down into lower percentages, pretty significantly lower percentages. So majority of the people who were tested at the Kingman event were Golden Valley or Kingman residents. When you move over to the Bullhead City testing event, 56% of those that participated were from Bullhead City, 22% were from Fort Mojave area, and then 12% were from Kingman. So we do have people driving from across the county to participate in these testing blitzes and these events. So we'll continue to monitor that for the Lake Havasu site and try to report out. It takes us a couple of days to get this level information from the staff, as they're usually pretty busy compiling all the results at that point. So any questions on the testing blitz? And
Supervisor Gold?
Thank you, Madam Chairman. Denise, did I hear you say that the contact tracing was not mandatory?
it is not. They actually have, and this is per one of our EPIs notified me of this, is that it's not a required, mandated, if you will. It's not mandated that people participate in the contact tracing.
Have you had people that chose not to participate?
We have had people who were reluctant, but I believe we've been able to encourage them and continue to recommend that, and I don't believe we have had anybody decline. But
You
I
have
can
to waterboard anybody, or?
no, no. But I will follow up on that question for you, just to make
Okay.
sure I have my facts straight.
I was just curious. Thank you.
Let's see here. We've modified our daily report to include some zip code level data. And if it's your pleasure, we would consider removing the testing information from that, because the testing information, if you remember correctly, doesn't include some of the smaller private providers, so it doesn't match the ADHS numbers that way. So we don't want to cause confusion, but the rest of the information, I think, is all information that can be shared publicly. And if you have any questions about that, that's something that we could actually post on our webpage each day as well, just as a daily update.
Does anybody have any problems?
I have a quick question.
Supervisor Angus.
I have some problems with the zip code. It doesn't match up, like on the state page, my zip code, it said 0, but then on ours, it said 1, and then where I know for sure there are some in a certain zip code, it said 0, so it was very confusing.
I will follow up on that, okay? And get some clarification on the why.
Okay. I don't see any other, other comments, so I guess nobody minds if you make that adjustment.
Okay. We'll make sure that that information is clarified, though, and accurate as far as ensuring that it matches within the ADHS database. And we are working with ADHS on some data issues, and we've actually identified something that they were not aware of, so we're working with them to correct that as well. And that's actually on a state level, and it affects all counties, in other words. So we'll continue to work through that with them. Other than that, I don't have any other updates at this point.
Okay, we'll go to the board members and see if they have any questions, and we'll begin with Supervisor Johnson. He's emailed his questions to the clerk of the board. Madam Clerk.
I'm here, Madam Chair. I don't have to have her do it.
Okay, Supervisor Johnson, go ahead then.
Thank you. There might be some big words she would stumble on. I've been contacted by constituents with concerns over reinfection. For example, some are saying that they got the virus, were hospitalized, then went home. They felt great for 10 days, then got really sick again and ended up back in the hospital. Some states are retesting these folks. Does Arizona retest so we can find out if it's just the virus flaring up or a reinfection?
I believe if someone were to return to a hospital, those individuals would be retested. But the hospitals make that determination, or a private provider. Those doctors would then make the determination as to whether or not they need to be retested at that point. I don't know that there's any, of course, specific effort to do that, but I do know that if someone were to have reoccurring symptoms, and return to the doctor, they would probably consider that as an option.
Are we seeing that as a problem for people who say we release them from home confines, but they're still able to pass on the virus to others?
I don't think we have seen that as a problem. I mean, we're following CDC and ADHS protocols regarding release from isolation, and those are really designed to ensure that people are no longer exhibiting symptoms and that that fever is gone for at least 72 hours without medication. So there is, if you will, sort of a buffer. You know, in normal flu season, typically what you would see is that someone would say that you can't return to work for 24 hours after your fever is gone after medication, or, you know, with no medication. So in this case, I think the guidelines are fairly straightforward for us, and we haven't, at least on our side, we have not seen an issue with that.
Did we receive an answer from the state on how the antibody testing plays into the statistics?
We have not yet, and in part they are putting that on their website, but we have not seen that information included in our case counts. So it's been separated out on their website.
Okay, so we're not seeing those who test positive for antibody going with our case count then?
Not yet. That's correct.
All right, the governor's new executive order says businesses shall come up with a reopening plan based on CDC guidelines and health official requirements. When we go out and do our inspections on restaurants, are we ensuring they are following CDC guidelines and making sure these places are safe for the public to go?
Supervisor Johnson, we recently, and as of today, our environmental health manager put together protocols for our inspections. And those protocols, I don't have them right in front of me, I just looked at them this morning, but it involves calling a operator in advance to understand more about what their policies and procedures are, and then to the degree that we can, to operate off of those same policies and procedures. For example, wearing a mask, certainly around social physical distancing, disinfectant, what are their protocols walking in? Some actually have hand sanitizer stations when you go into the business, and they require people to use them, or at least that's their guidance is to use them. So we'll be following those, and if we learn that we need to modify that process in any way in those protocols, we'll certainly do so to adjust for the operator's business needs.
All right. On your report, you send us kind of a follow-up to Supervisor Angus. We are now listing zip codes, but those numbers are not matching up with the state. For example, Bullhead City zip code 442, you have 11 cases, and the state has 20 cases. Do we know what the difference is?
I'm going to follow up with that and get back with you, Supervisor Johnson. I apologize. I don't have that answer at this moment. We'll make sure that we go back through that zip code level data and learn why those differences exist.
All right. And you were talking about the self-tracking via the internet or text. Have we started that? And if so, how is it working out?
We have not started it yet. ADHS is still finalizing the process on their end and finalizing that, the use of that system with the actual company. And as soon as we have more information, we'll be able to provide, as soon as we start using the system, we'll have a lot more information about how it's working and be able to provide an update to you.
All right. My last question is, have we decided we're going to continue to send out our daily reports after 6 o'clock every day?
We've been trying to just close out the day after 5 o'clock. And by doing so, that's the cutoff for ADHS. And we've sort of moved to that anyway, just to try to make sure we capture all the cases for that particular day. But that also feeds into the discussion about one of the issues we found with the ADHS system that we're trying to resolve. So that will resolve a problem for us and for other counties as well. So
right,
I would prefer to do that if we could, or have it ready to be released somewhere between 5 and 6, just so that we can get that information out, but it can be as complete as possible.
All right, thank you, Director and Madam Chair.
Okay. Supervisor Watson, do you have any questions?
No, I don't. Thank you very much.
Supervisor
for a
Angus?
Full presentation this morning.
Thank you. When this contact tracing program comes, can we get some kind of presentation about it? I think there are many people here and out there who are interested in it.
Absolutely, be happy to do so.
Okay, thanks.
Supervisor Gold?
Thank you, Madam Chairman. Denise, this is not the contact tracing program that I've heard about on the internet where they're using Google and Apple phones?
No, it is not.
Thank you.
This is very different, yes. And I realize some software programs and applications have location services, not us. That is not an area that we are interested in. We're merely asking people to go in and add their information so that we can monitor their health. That's it.
Okay, so it's not any, we're not tracking them as they move, as they have moved in the past through the community?
We are not.
Okay. When you're talking about protocols, it sounded like you're getting the business's protocols from the business and then making sure they're conforming to their own protocols?
What we're doing is we're reaching out, because each business essentially has their own protocols. They're following the CDC guidance and they're interpreting it based on their own business. So we're calling ahead to ask, for example, do you require a mask in your business? And if so, we would ask our inspector to ensure that they wore a mask. And if we had an inspector, for example, that was unable to wear a mask because of health concerns, then we may switch that inspector to a different role for that particular inspection and send a different inspector that could. So we want to be sure that we're respecting those new business protocols that they have put in place when we go to actually perform the inspection.
So we're inspecting to hold them to their own protocol?
Well, we're not holding them to that. We'll still go in and just do our food permit and our food inspections. That's our role. But in terms of any kind of CDC guidance that they've put in place for people that come and visit their business, we want to make sure that we're respecting those.
So the health department is not enforcing their social distancing, mask wearing, hand sanitizer use and all that? Okay.
No. No. That is the business's responsibility, and I think they have embraced that.
Okay. Thank you.
Mm-hmm.
Okay. Anything further? Denise, do you have anything on closing?
I do not.
Okay. Then this meeting is adjourned. Nope.
You have 2 more items.
Oh, your part of the meeting is adjourned. Thank you, Denise.
Thank you.
We do have other agenda items this time. We have a discussion of possible action to appoint Marilyn Shore to serve as a board of director on the Yucca Fire District Board. Marilyn Shore will serve the term vacated by Terry Underhill, which term is scheduled to expire at the end of November 2020. Supervisor Gold, do you have anything additional?
Thank you, Madam Chairman. I think Marilyn Shore would be a great addition to the Yucca Volunteer Fire Board. She's currently a school board member with the Yucca School District. They had 2 resignations. It's a 3-member board, which is why it came to us, because they no longer had a quorum. So by appointing Marilyn, they'll go back to having a quorum and they can find another replacement for the other, which is a better way than us doing it, I believe.
I believe you're correct. So is that in the form of a motion?
I will put it in the form of a motion. I move that item 2 be adopted.
Second.
Question.
In a second, all those in favor say aye.
Aye.
Any opposed? All right, motion passes. Congratulations, Marilyn. The next and last item brought to us by Emergency Management Director Byron Stewart. This will be a discussion of possible action to approve the outdoor fire and permissible consumer fireworks prohibition proclamation dated May 14th, 2020, and effective May 15th, 2020, for the unincorporated areas of Mojave County due to the increased fire danger from extremely dry vegetation and heavy fuel loads, as well as potential COVID-19 consequences to first responders and the public from a large fire that requires evacuations.
Motion to approve?
Second.
Have a motion and a second. All those in favor say aye.
Aye.
Any opposed?
No.
Okay, motion passes. This meeting is adjourned.